So, first of all, I do want to acknowledge that I personally am located on Treaty 6 territory, which is the traditional lands of First Nations and Métis people. I also recognize that we are located across Canada and the US, and later this afternoon we will be joined by someone from New Zealand in the home of the Maori. So I would like us all to take a few minutes to acknowledge the territory that we are meeting on. As I mentioned, this grant is a partnership. We are funded by the Canadian Institute of Health Research, the Institute of Nutrition, Metabolism and Diabetes, for an institute support grant for a dissemination and planning grant. And our partners are Health Canada, in particular the Office of Nutrition Policy and Promotion, and the Alberta Policy Coalition for Chronic Disease Prevention. So, the food environment. I thought I would actually start off talking about food environment before we get into digital food environment. I think most of you are well familiar that we've been talking about food environments in Canada for at least about a decade, and recognizing that food environments shape the availability, the affordability, and the social acceptability of food and nutrition choices. That very much the choices that we make are very much influenced by the environment in which our food is made available to us. We also know that there are associations between food environments and diet-related outcomes. And today we're going to focus in on digital food environments. So it wasn't as if our food environments weren't complicated enough. Now we have this additional layer of complexity that we can get our food over through computer apps. We can order our groceries online. We can order meal kits. And food and beverages are being regularly marketed to us in digital means, and how do we actually understand how that's influencing people's diets, and how do we understand how to manage the negatives and exploit the positives, really. So that's basically what we're here to talk about today. So our objectives, and these are the objectives that were right in our grant proposal, are first of all, to identify public health and research priorities for digital food environments. Secondly, to foster collaborations to develop research programs and projects on digital food environments. So we're hoping that we have a virtual room of potential collaborators here today. And thirdly, to build capacity to advance research and translate knowledge about digital food environments. So the purpose of today, well, we started out to collect some baseline data around priorities for digital food environment research and interventions. We started out with a pre-meeting survey to identify the areas of digital food environments that are most relevant to Canadians. And Melissa will be presenting that data this afternoon, and there is a summary of some of that data in the book that was sent out yesterday. So that is like your little manual for today. If you have any issues, anything that you will need to access is in that digital book. This morning, it is mostly presentations. We have presentations by a variety of experts on digital food environments to really help us all understand the challenges and opportunities that digitization poses for consumers and regulators, and to really help us all come up to speed and have a level playing field for our discussions this afternoon. This afternoon is going to, and I tell you, other than the practice session that we had, it's my first time using the breakout rooms in Zooms, so I'm hoping that it's successful. But we're going to have breakout groups to discuss research and public health priorities. On the initial plan for the conference, we had planned to do some ranking to come up with our priorities. I think that's going to be a little challenging given given the digital meeting format. So we'll talk about, you know, what was of priority in each of our breakout groups, but we will also follow up with a post meeting survey or questionnaire to help us to come up with ranking according to two things: one, the impact on health, and second, the feasibility that we can actually do some of this stuff. So that's where we want to end up. So what are your activities and roles? Well, this morning, other than the presenters, the rest of you, I will expect you to be active listeners. I neglected to say at the beginning, but as we are listening to the presentations, it would probably be a good idea for us to mute our microphones so that there's not any interference, and it also just helps with the bandwidth. In the afternoon, we will ask you to be active participants in breakout sessions. They are organized by topic, and we used your indications of your interests in digital food environments to group you into groups that have common interests. Some people it was a little difficult because some people have interests that span the whole spectrum of digital food environments, but we do have moderators for each of those groups. We also have note takers for each of those groups. And then we will also have a report back where we will start to look at some of the priorities. After the meeting, we will ask you again to consider collaborations on policy and practice relevant research on digital food environments. And the ultimate goal is to write a review/consensus paper if we're able to come to some sort of consensus, and then also to develop some research proposals around measuring, monitoring, or changing digital food environments. So that is the plan for the day. And now I am going to turn it over to Melissa Fernandez, who, as I mentioned, is a postdoctoral fellow in the School of Public Health at University of Alberta. And I will also mention that although I'm on the grant, because I have to be as a faculty member, this is really Melissa's brainchild. This is her passion, and this is where I see her making a unique contribution to research in the future. So I'm really looking forward to hearing what Melissa has to say today. Melissa.
All right, Kim, you just need to stop sharing your screen. Good morning, everyone. I am very excited that we're all here to be able to talk about digital food environments together. As Kim said, this has become my passion and a personal research mission to create some awareness around the digital components of our food environments. So today, our colleague Kayla has created a hashtag. So feel free to engage in some social media, which is very appropriate given the digital topic. When we talk about digital food environments, we're really talking about the digital components that are part of our regular food environment and that have an influence on health and nutrition. These components include digital actors and activities and settings, and these actors can play a role both in the offline environment and the online environment, such as public health and the food industry, but there are going to be unique actors that have a role only in the online environment, such as our social media influencers. Similarly, there are going to be activities that take place both online and offline, like food marketing and health promotion, but there are going to be activities that are unique to the digital environments, such as sharing and engaging in user-generated content online. And all of these activities take place in digital settings like websites and apps, video games, and of course, social media. So this digital food environment has been described by Sabrina Granheim, who is here on the call today, in a paper that she wrote last year, and her group in Norway. So we also have someone from Norway on the call today. So we are a little bit more international. And her group is working on mapping digital food environments. And I'm really excited for the results of this work so we can see how all these pieces really fit together. But in the meantime, I'm going to be describing how our environment has been transformed. And a lot of this has happened really in the last decade with the use or widespread use of wireless internet. So to describe how this environment is changing, I'm just going to take a step back and go through the food environment domains. So these are the classic 5 domains of our food environment. Our physical environment essentially dictates the kinds of foods that are available to us. The communication environment dictates what messages are essentially which messages we hear, and this can be from the media, it can be from food marketing, or it can be from health promotion. And the economic environment essentially dictates how much food costs, and this will essentially imply how much or what kinds of foods we can afford to buy, which has an influence on food security. And our political environment establishes the rules around food, such as the front of package labeling. And of course, our social environment influences our attitudes and beliefs around food and nutrition, which ultimately shape our eating practices. Now, once we throw the internet, and again, I mentioned the wireless internet in particular, into this environment, it all shifts around. So things become a little bit more blurry. Our political environment doesn't change necessarily, but it does become more complex to regulate. And the reason for this is because our digital actors, our digital activities, and our digital settings are very dynamic and they evolve very rapidly, and some of them are very transient. So it can be quite difficult to conceptualize regulating moving targets. Our social environment turns into social media online, and our communication environment turns into online communication. And these 2 domains overlap considerably online. And our physical environment and economic environment become replaced with this idea of online to offline food retail, where we can purchase food through digital transactions or virtual transactions, and we receive it either through pickup or have it delivered to our homes. So it changes our access to the food environment. And the digital food retail, in this group, there's a lot of different types, but we really have 3 broad groups that are popular in Canada. The most popular are food delivery apps, and there are about 29% of Canadians who use these apps regularly. Meal kits in Canada have been used by 20% of Canadians, and online groceries, while they are the oldest of the 3 types of services, they're used by 16% or have been used by 16% of Canadians. Of course, these statistics are from 2018 and 2019, and they are likely to be much higher given our current COVID situation, which is catapulting everything that's digital. And we have someone who will be talking about this specifically a little bit later on today. What all of these services have in common, though they are very different, they all respond to the consumer's need for convenience, particularly in relation to saving time or the perception of saving time. What we don't know much about are the potential impacts of these services on our eating practices. And the evidence that we do have is limited. It does come mostly from online grocery studies. So we do have some evidence of things like reduced impulse purchasing of junk food in online grocery settings. We also see that there can be greater access to different kinds of foods, both healthy and unhealthy. In terms of access to healthier food, there are pilot projects that are ongoing right now in the US in particular through the SNAP Ed program around using online groceries to increase access to healthy foods such as fruits and vegetables in areas where there might be food deserts or food swamps. Our research team is currently doing a study. We just finished data collection. It's a qualitative study examining the context around why Canadians use these digital food services. And we've interviewed 34 Canadians across the country of all different ages. I'm going to give you two examples. The first one is from a 16-year-old high school student who started using online food delivery apps 2 years ago, so when they were 14. And this individual describes a situation where she orders McDonald's through Skip the Dishes to her school for lunch. She says there's a limited number of what's in walking distance and what actually makes sense to walk that far to get food, whereas you can just pay a little bit more and get it delivered and get what you really want to eat for lunch that day. So I think this illustrates in a very real way the increased access to those convenience and junk food that might impact youth. And I think we really have to ask ourselves the question of what are the long-term impacts of this increased access to these convenience and restaurant foods, which tend to be high in sodium, high in saturated fat, and even some of them high in sugar. The next example is from a 50-year-old woman who describes online groceries in terms of it being a valuable support right now in terms of COVID for people in that age group. I've been sort of doing everything I can to help them get on board. I type out a little step-by-step and have distributed that to my sister and my sister-in-law, who are both over 70, and they're distributing it to their friends. So this is a description of how much of a support online groceries and maybe some other aspects of these services can be to some vulnerable populations, in this case, the elderly. I think it also highlights the fact that maybe we tend to focus on youth, especially when we're talking about anything digital. We think about millennials and we think about teenagers. But there are some very practical uses for some of these services, even for older adults, that we can, I think we need to consider. So online communication and social media, as I mentioned, they overlap significantly online, and I believe they become a lot more prominent and a lot more influential. So we do see that social media and things like Google have become a really important source of food and nutrition information for the public. People both seek information actively by typing things into a search bar, and they're also passively exposed to it through their feeds on their social media pages and things that their followers like. So there are some unique attributes to this online communication. First off, anyone can generate content, which has given rise to influencers essentially. And anyone can engage with that content by sharing it, by liking it, by commenting on it, which makes things like food and beverage marketing all that more pervasive because it can be shared and the reach can be expanded so easily. Another aspect which can be quite positive is the idea of social support. So there are some groups such as breastfeeding support groups online. There might be support groups for family members of people or children who have type 1 diabetes. There are some positive aspects to this. As I mentioned, food and beverage marketing, because of these unique attributes, end up being become very personalized, and the food industry can target people very easily through marketing based on individuals' preferences and your own and the data that's generated from that. I'm not going to mention much about this because we do have speakers who will be discussing this later on. I will say a little bit about food and nutrition influencers, which I think is the most fascinating part because they are completely independent of big food. And I think they do pose a significant regulatory challenge. And our team has explored these influencers, of course, because of all these aspects, as I mentioned, these influences are going to be much more impactful on our food and nutrition knowledge online than they might be offline. And our team has been working a little bit studying Instagram influencers, and we have defined the idea of influencer as someone who promotes products, services, or ideas about food, nutrition, or the diet. And in this study, we have done some content analysis of website profiles and Instagram posts. And we say we're using a small data approach because there's only 116 influencers in our sample, and we're not examining millions of posts. And this allows us to do a little bit of rich data content analysis. I'm going to give you two examples of a little bit of or a little sneak peek of some of the research we've been doing. Part of it is profiling the influencers. So this is a profile of what we call a self-taught cook. And we often think of influencers as foes, but there may be some public health allies in a minority group of influencers. This particular one mentions on her website that I used the blog as a way of filling my time. As I learned to cook, photograph, and document what I was creating, I quickly found a deep passion for what I was doing and shared the blog with friends and family. It quickly started building an audience, and somehow it's now had over 130 million hits. And her Instagram account alone has 1.6 million Instagram followers. We cannot buy this influence or this publicity in public health. And this is completely independent of any kind of health information. These types of influencers may be really useful in terms of translating food skills to the public, particularly when it comes to promoting fruits and vegetables and getting people to learn how to use lentils and beans and tofu in a way that makes them really appealing and in a very accessible manner. Another small spin-off study that we've looked at is really the credibility of the nutrition information that is posted by these Instagram influencers. And we compared the credibility using essentially rating it with the Dietitians of the Candidate Checklist to evaluate credibility of information. And we compared health professionals to non-health professionals. It is no surprise that health professionals score better than non-health professionals, but health professionals aren't doing that well. So there's two things here. One, that these types of tools may not be very useful on a platform that's very visual, such as Instagram, that has really appealing pictures or videos and not much text. The second one is that it is really hard to make health information interesting without making it sound sensational. So I think there is quite a bit of work to be done in trying to develop tools that will help the public recognize credible information for these different kinds of emerging platforms, and also to help health professionals post the best kinds of information that gets as much attention as the non-health professionals. In terms of the political environment, as I mentioned, this environment doesn't change per se, but there are going to be some unique regulatory challenges. For example, in terms of food labeling, anything that's on a nutrition facts education table at the back of a product or the side of a product is going to be very difficult to see online without clicking multiple pictures, without scrolling the page. And it's going to be difficult to compare different products on a screen. So it draws attention about how to make these types of policies or regulations relevant on online platforms, especially if people are buying food or groceries from their cell phones. Other things are related to food and beverage marketing in terms of how do you regulate marketing on a live feed or a Snapchat or some of these emerging platforms, and how do you regulate an influencer from marketing to children when they are not oriented towards the children's audience. So there's some different kinds of aspects to think about, because some of the marketing that's happening is not just the food industry. And of course, misinformation and disinformation. This is really shaping how the public thinks about food. And it may have a particular influence on young women and young people. And of course, the issue of regulating misinformation and disinformation goes beyond nutrition. And right now, I don't think we have good tools to fight these types of issues. So we have a lot more answers and questions, and I think we really need to think about which environments we can actually feasibly regulate and how we can adapt to other digital environments that can't be regulated. So by the end of today, we are going to hear from a series of speakers who will be covering all the different topics that I mentioned today to differing extents. We have Alfred and Maya from Health Canada who will be talking about the challenges and opportunities of these digital food environments. Monique is going to be talking about digital food marketing. We have Alessandro who's going to be talking about misinformation on social media. Sylvain will be talking about our digital food retail during our COVID crisis. And Becky will be giving us some of the information about the methods that she's been using in Australia and New Zealand to study online food communication. So today's breakout sessions mirror all of these topics. We have one about food and beverage marketing, digital food retail, social media, data collection and analysis, and knowledge translation. After our breakout sessions, we're going to have a little discussion to really figure out what the priorities are right now that we should be addressing and how do we address them. So after the meeting, as Kim mentioned, the next steps are really to rank these priorities, and we'll be sending an online activity to do that. We will be preparing a review paper that will contain a set of recommendations, and we will be looking for collaborators on a project grant. So that is all I have for my introductory presentation to digital food environments. And we do